I'd like to call the meeting to order at 6:39 p.m. And Mallory can read the virtual meeting statement.
All right, so the virtual meeting statement. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, subsection 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, the meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found at www.hubbardstonma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or comprehensive record of proceedings as soon as possible.
Okay. So first item is to review the meetings minutes from the last meetings. And are those attached to one of the emails that you sent?
Yeah, it's with the agenda. Ooh, I sent it last week.
Ah, see.
Because we were off Monday. So it should have gone up Thursday?
Yeah, the 8th.
8th.
They look correct to me.
I just want to.
I had read them and they look fine.
Yeah, I see no corrections.
Make a motion, we accept them as written.
I'll second that. And then all in favor, Kathy?
Yes.
Judy?
Yeah.
Colleen?
Yes.
And Kate, yes. All right, meetings are accepted. And next item on the agenda, COVID-19 update. Anything on the list for that, Mallory?
Yeah, so we do have 2 new cases of COVID in town. So it brings our total number to 10. I don't know if they would have been reflected on the Wednesday state report for all cities and towns. So that's where we're sitting right now, is at 10 cases since the beginning. So 2 active and then 8 prior.
Mm-hmm.
Both are from the same
kids. Yeah, there's more kids that I've noticed getting tested, but that's part of the school requirements. They can't go back to school if they've been sick.
Mm-hmm. Right. Any sniffle.
Yeah, that means they get tested.
Yep. Make sure everyone gets their allergy pills in the morning.
There's 1650 was the number I saw last week as having been tested out of the total population. So having only 10 cases that are positive out of 1650, that's pretty good.
Yeah, very good.
I know I got tested. It wasn't pleasant. I wasn't lucky enough to have the facility my doctor works with to be a spit test place, so it was not fun. But anyway, so anything else on the COVID-19 update?
Nope.
All right.
Pretty much where we're sitting. The only other thing I guess we can add is that we had our meeting on Halloween, and Chief Perrin did decide to extend the hours from 4:30 to 7:30. So we got that extra hour to allow for trick-or-treaters.
I haven't taken time, Mallory, to check the website. Have you posted guidelines on the website for Halloween?
Yeah, we were getting them all over social media, and I was working on one for the website because anytime I tried to post it on our town website, it got like convoluted. And so I think I finally have it down, and I'll probably get it up tomorrow with all of the guidelines. But everything else is posted on all the social medias.
Oh, okay.
Very good. Okay, the MPHN nursing report.
Something new. I was in contact with Sandy over the 2 new cases. Just had a brief talk about how they were home and recuperating. Other than that, we haven't had to be in contact. So she did all the tracing and all that good stuff.
Any other discussion on that from the board? All right. Hearing none, we'll move to failed systems awaiting action. The first being 10 Main Street.
I haven't gotten anything from them.
Okay.
Really?
I did have Jake Pettis in the office. He was researching another property because he's been pretty busy doing Title V's in town. And he said he was called out recently to take a look at the job and the plans that Mark had drawn up that Jen, Susan, Roy had signed off on. And he advised the homeowner it might be best to get a new set of plans and to start fresh. But he hasn't heard anything since he was called out. So I know they are actively calling and trying to get quotes, but I haven't gotten anything.
Okay.
And in terms of an action timeline that we put forth to them previously, how was that stated in that letter?
They had 2 weeks to get started.
Okay.
And to report back to us, and they have not reported back to us. Everything I've gotten has either come from interactions with other people in the office or from them interacting with town administrator.
Mm-hmm.
Well, send them another letter. Their 2 weeks is up. We haven't heard.
Okay.
We're going to start finding them if we don't hear in the next 10 business days.
I would ask them to come before the board
For the next meeting.
That's a
for
good
the next
point.
meeting.
Yes.
And we have an in-person or a Zoom talk with them. And then from that point forward, we start issuing fines. I don't know how the rest of the board feels about that and open a discussion.
I think that sounds great, Kate.
Yeah.
I agree.
Been an awfully long, drawn out thing.
Years.
Yep. So please invite them to the next meeting.
Love to.
Okay. Anything else on 10 Main Street before we move on? All right, 68 New Westminster Road.
So this one failed. I think last meeting we got the failed Title V report. Kathy, and they've been in contact with you to schedule the perk, right?
No, not 68.
Okay, so you haven't heard from them
I was
yet.
thinking it was 68, and I just looked it up. What I got. Luke wants to do a perk at 18 New Westminster Road.
Oh, okay. Well, they did apply for a perk test, and they're using someone not so local. So I did advise the installer, the equipment operator, and the engineer when they're ready, and they have a date that they needed to contact Kathy direct. So I guess they haven't yet. But like I said, she's from, I want to say Connecticut. She's a daughter. She's handling it for her mother.
Yeah.
So they are aware.
Okay.
Anything else under failed systems? All right, passed and failed Title V.
These, the 1, 2, 3, 4, 5, 6 past ones, I guess, on 39 Chippewa and 29 High, I forgot to write past. So those all came in the office within the last 2 weeks. All of them passed. We did get a failed system on 174 Gardner Road, and I sent them the perk application, which they filled out and then sent back to Kathy. And then 2 Crossroad was a conditional pass. They had a cracked tank and a riser issue, needed a new D-box, and the fields needed to be scrubbed out of all shrubbery and stuff like that. And they applied for an emergency repair, which they did. Kathy, did you get to inspect that?
Yes, I inspected that, took photos. Was that last Thursday, I think?
Mm-hmm.
174 Gardner Road. We did the perk test yesterday, and it passed slowly. We did perk test on 39 Williamsville Road today, which passed quickly, thank goodness, because it was raining. Tomorrow I'm doing a perk test at 8 a.m. at 106 Gardner Road. They just keep coming.
Yeah, I guess.
Good.
So
The
to
hub-
Crossroad, they put in a new tank. They were doing a good job repairing it completely. I didn't go back for the final inspection. I guess I should do that, right?
Yeah, and we can sign off on the COC when that's done.
Do final.
Doesn't the engineer sign off on the final?
This
Yeah.
was just, yeah, this was just a repair, so there wasn't any engineered plans for it, for a component repair.
Okay. Well, does
But
that really,
usually-
does that require a final?
Or certificate
Yeah,
of completion.
Yeah. I'll have to go back. Another one. Okay.
Okay.
I
Any other
also
questions?
heard, let's see, Collier's Place may be ready to begin their septic system next week.
Oh, great.
So, Brigham Road, right? They're
59.
Yeah. So keep that on the list as an open case.
So Kathy, you jumped down to open repairs and perks. Do you want
Oh,
to just continue
sorry.
with that and close out that topic, and then we'll jump up to permits?
Right. Thank you. Right. 35 Mount Jeff, it's new construction. I haven't heard anything new. 51 Root Road, I haven't heard anything about that one.
No,
Brigham Road, like I said, is probably going to be starting the septic next week. I saw Jeff today at the Hackler, the excavator today, so he knows to call me when things are starting to move forward on that one. 106 Old Princeton Road, where are we on that one?
I think that one's on hold.
Right, that one's on.
Yeah, it's going to be an in-law, and they need to do a little more than they thought they did. So that's going to probably be on hold for a little bit. It's going to be, they have to upgrade.
Yeah. Okay. That's it in a nutshell. 3 or 4 or 5 things every week.
Wow.
Because once you do the perk, once they do the bed bottom, you have to go back, take pictures of that. Once they lay the system in, you go back and inspect that. Once they complete it, you go back again. So for each system, there's up to 4 visits. Which brings me to another subject that I've been trying to put out the word to some of the guys that run the perk tests about getting someone else to help me out. And today I got a call from a fella who lives in Orange. I'd like to put out a notice that we are interested in hiring an additional septic inspector.
Do we want to handle that under new business, Kathy? Go through the rest of the agenda.
I just want to throw that out before I forget.
No worries. So we've handled the past failed Title V, open repairs and inspections, and perks.
Yep.
Okay.
All done.
So permits to be voted on.
So we have 2 permits, pie and bake sale for the Historical Society, and then a new installer to town. So I sent both of those over, and Kathy sent over the Historical Society as well.
Okay.
So for the Historical Society, I sent to you guys this morning a PDF of the guidelines, very simple outline of how it will be run. Did anyone get to see it?
I did not. So one of the issues I've been having is if it doesn't go to my Board of Health email, I don't see it until
I saw it, Kathy.
back.
I saw it.
Yeah,
I read it.
I'll forward over to you.
It looked okay.
I didn't see it.
Do you want me to send it, Judy, to your regular email or to the Board of Health computer email address?
The Rail and Sue address is fine.
That's okay. That's what I sent it to. All right.
Yeah. I may have missed it.
Here, I just
All right.
I just sent it to myself, and I'm going to.
Okay. Trying to find it in the C emails from today.
Yep. And I will share my screen if that helps. Yep, sure. Yep, share my screen. So you guys should be able to see this. Oops. I don't know why it's not letting me. Oh, come on. Okay, it's not working. Hold on. There we go. Let me open in a new window. That's better. And then, so the event guidelines are here, if you can read that. So you're basically going to set up the space for like a loop in and out?
Yes, it's going to be a loop. We now have a ramp going out the quote kitchen door, which is a second door in the building. And so people can come in the front door, which is 2 steps, and then tables will be angled directly from there straight to the exit. Chairs will be positioned so that that's the only way they can go.
Okay.
Sorry about that. And everything will be covered. The biggest concerns I have is keeping a list of who the bakers are and what items they baked.
Gotcha.
So we have a good record of everything.
Yep. Well, bake sales typically fall under like the potluck type event in terms of food safety in any event.
Yes.
It's considered a purchase and eat at your own risk community type event. It's how it's true. It's how it's laid out. But I think the plan for managing it from a COVID perspective looks good. Are there hand washing? So there's hand sanitizer for the public as well, or is there hand washing in bathroom facilities?
It's going to be hand sanitizer for both.
Okay.
Because there's not much water there to speak of. So it'll be a hand sanitizer event for both the volunteers and the customers.
Okay. And are you guys having an occupancy limit, or what's the general consensus that the group has come up with in terms of how many people should be in that building?
There will probably be 3 volunteers max. And then again, probably no more than 10 customers coming through. But if they're staging themselves 6 feet apart, that it's going to be like 7 people in the building at a time.
Got it.
Where is this being held?
The Williamsville Chapel. It's not that big.
Oh, okay. It's not that big.
No.
So you're going to be restricted just by space alone.
Correct. That's why I didn't really list anything. So we're following the 6 feet apart rule.
Gotcha.
There's not going to be an occupancy problem at all.
Yeah. Any other questions from members of the board? All right, hearing none, I'll take a motion, or I'll make a motion that we accept the historical pie and bake sale event as structured.
I'll second it.
All right, and Kathy won't be voting, so I will vote yes. Colleen?
Yes.
And Judy?
Yeah, it's fine.
All right.
Thank you, folks.
And moving on to, now I have to find the agenda page. The problem with sharing my screen, it messes me up.
Yeah, I lost the agenda too.
Philip Colomet, installer.
Yep. So Phil is looking to do a repair in town. So he's never been permitted with Hubbardston. He does have his Neshoba Valley installer's permit, which is pretty prestigious as far as installer's permits go. So we just need to vote to approve if he can put a system in the ground. Did you guys ever at one point give installers a quiz?
Yes, there was a quiz at one point.
Yeah. Okay.
I thought it was developed by the state because I don't think we sat down and did it, but
yeah, I think usually it is put out by the state. So usually what happens is if someone's new to town, they take like I think it was 10 questions, pretty easy quiz. And then it's just,
or if they can show, or if they can prove that they've already got permits in the other towns,
then
they're good to go.
Yeah, it's just to kind of avoid people saying they're installers, but they're not. But I did check and he does have a valid license.
And
it helps if you can get references from work too. So that way you have it on file and people can, if they question it, then you've got the ability to back them up or support the decision.
And Neshoba is the only other municipality that he's licensed in?
Yeah, so that one covers a bunch of towns.
Yeah. Got it. And any other questions from the board on this particular installer permit? All right, hearing none, I'll take a motion if anyone wants to make one.
I move that we approve his permit.
All right, I would second that. And we'll start, Kathy?
Yes.
Judy?
Yep.
And Colleen?
Yes.
And Kate's a yes.
If it's okay with the board too, I think I'd like to kind of take a look at our installer's application, see if I can update it so that we can include references are mandated, and if not, maybe bring back that quiz if you don't have 2 or more references, just to protect us in Hubbardston.
That's a very good idea, Mallory. Go for it.
Awesome. Thank you.
Right. Anything else under permits before we move on?
No, ma'am.
All right, open complaints. 248 Gardner Road and 111 Gardner Road.
I got that card back from 248 Gardner Road this afternoon in the mail. So we did get our certified letter. And I got a call from a tenant named Jason, who simply on the voicemail said, I'm calling about a fire violation that I had. So you can call me back, but didn't leave a number. So I'm hoping I can catch him when he calls back.
That's the one on the Gardner line, right?
Yeah.
Yeah, the other day we drove by and I saw that there were a couple of folks out there talking, and I thought one of them, was a quick drive-by, but I thought one of them looked like Greg, so it looked like maybe he was going over what the complaint was with him. So I'm hoping that's what it was going on, and hoping that that's a positive sign. But
Definitely.
I did see some activity over there, and so I almost stopped, but then I said, no. So
yeah, so I will, hopefully they'll call back if they're open to calling once. Maybe if they don't call back by the end of the week, I'll just send a little note that's like, sorry, I missed your call.
Or it might be worth it, somebody just drop by. So, I mean, I don't have a problem. I'll just take my husband and
yeah, don't go alone.
A policeman with me. We'll be good.
So 111 Gardner Road now has a tractor on the front lawn and a covered boat. So I think they have the ability to afford getting stuff cleaned up. I don't know why they moved the couch to the side instead of right smack in the front of the lawn. The tractor is now in the front of the lawn. So I'm not sure what we should do about them.
They haven't sent back their green card yet either, so they haven't picked up or acknowledged their certified letter.
Stuck.
I see a fella last week. I went out shopping in the evening to the grocery store and saw a fella working there. So didn't seem like a really old guy or anything. So I think they would have the wherewithal to be able to clean stuff up if they wanted to. I'm not sure what we should do at this point.
So are you thinking that maybe a visit would be worthwhile, just to go on the lawn, on the property, and if they're there, and just say, hey, hi, on the Board of Health, and we have some concerns, and kind of see where it plays out from there?
Yeah, I'd like to take a policeman with me if I got time to do that.
Well, I'll see I'll do a couple of drive-bys, this week, because I need to get out and about. So I'll see if I can see if there's any activity there.
Okay, with all these perk tests and stuff going on, if someone else can pick up and help with this, that would be great, because I don't, my free time is going for perks and stuff like that.
Judy,
yeah, I can do that.
Thank you,
Judy.
Judy.
Have you gone to see Chief to get a badge yet?
No, I
So
have
you-
a trillion badges here, but none of them work.
Just put a couple on.
Yeah.
3 or 4. They won't know
Yeah.
which one they should look at.
MRC, EMD, you name it,
Should make
But I'll
a
go down and see if I can get that taken care of also this week.
Judy, we're gonna have to get you a diorama for all your badges so you can have a display of them.
We'll get you one of those.
I just keep putting them on one lanyard, and I just, move them around.
Throw your back out.
Yeah.
All right. Well, let us know if you need any backup other than your husband and the police.
Okay.
All right.
Thank you,
Anything
Judy.
anything else under complaints? All right. New business. Title V loan request.
Yeah, so actually I just got the approval from Matt. He emailed me and said he's going to approve the plans that were submitted. There was some issues or conversation that Matt was having with Mark Popham, who designed the plans, in regards to the slope. So Matt just revisited Title V and realized that Mark's plan was okay into code. So he's going to drop off the plan sometime this week, and I will draft all of the documents that we need to take a look and vote on the Title V loan next meeting.
Okay. An EDF plan.
You want to take it away, Judy, or do you want?
Oh, geez. So I've been having some interesting conversations with the folks at DPH. So we had the EDS plan, and it was given to me actually last spring, and I had to set it aside because of COVID. So when I finally had a chance to kind of take a look at it, it didn't really read well. It is very comprehensive. The information, they threw everything in there, including the kitchen sink for this plan. So it's very comprehensive, but trying to read through it was like a flippin' nightmare. I'm sorry, but it was a flippin' nightmare. And I mean, and there were things like, there was a sentence that would just suddenly pop up in the middle of a topic, and you say, like, where did this come from? And it was in the edit, and there were things like, I really have a problem with documents that are not done in the third person. So a lot of stuff was done in the second person. And so this is supposed to be, a guidebook. It's not supposed to be, with yous and I's and we's in it. It's supposed to be more of a more objective, professional type of document. So I'm down to chapter 8 now. What I did is I sat down once with Mallory to see if she liked what I was doing or what I was thinking, of just taking the subjects and putting them in a chapter. Like, for instance, the incident command system, put that all in one chapter. Put all of the information about security all in one chapter instead of scattering it throughout the document. So I've been creating chapters, and there's about 12 chapters. So I'm up on chapter 8, and what I'm doing right now is not so much putting the documentation in, but I'm trying to get the support documents all lined up in the right spot. And like, for instance, finance doesn't have any documents. So I'm trying to have, looking through some other sources to see what we could do. So every chapter will have a description of what it's all about, and then they'll have support documents behind it. So like response, there's a quick start checklist, and then there's, then in the back behind it will be the support documents. We'll have some maps and things like that. So it's a work in progress. But then I was talking to somebody from DPH, and they said, well, the state really doesn't want you to rearrange the template that they sent out to everybody. And I said, well, you really can't use it. You're supposed to be able to, they tell you need to have a paper copy at an EDS. And then through the document, it says, please click on the blue highlighted link. And of course, none of the links work, but you can't click on a link if it's a paper copy anyway. So there's a lot of stuff like that. So to me, a template is you take it, you use it as your guide, and then you mold it to what you're comfortable with, that the town is willing to accept. So that's what I've been doing with it. Like I said, I didn't throw anything out. I kept everything. I just kind of rearranged it. But I'm hoping to have it completed in sometime in the next couple of weeks. And with getting all the supports in. I took this past weekend off to visit with my grandson. So I lost a couple of days there. So I'm hoping to find a couple of days over this coming weekend and get it all done. And then hopefully I'll have it within, if not the next meeting, the meeting after that. And then you folks can do what you wish. My recommendation is to take the original template and put it in the back of a 3-ring binder. There's also another template that is also the state also wrote and suggested for boards of health. And we can print that one up and just kind of use those as additional resources behind what we finally decide that we're going to accept.
I think that's a good idea.
Yay, Judy.
It's been hard. It's really been hard because, you're trying to do, and I'm glad I'm doing it in chapters, because when you're jumping around, you go flipping back and forth between the appendixes and then moving back up to the work you're trying to read. And I just found it totally much too confusing. I like things that just go through 1, 2, 3.
And also imagine trying to use it as a working document in an emergency situation, and you can't even get through the paragraph language because it trips you up. Because when you presented it to us last spring and you came in and you talked to us about it, I started reading through the documentation you provided, and I was like, how is anybody going to use this in an emergency?
Well, I'm so glad to hear that you felt the same way, because I just couldn't see how you could use it in an emergency. It just wasn't user friendly.
Right. Yeah, I think having that summary page is key, and because it tells you what what like what you're looking at, what the next chapter is going to be about, so that you can skip it if you don't need it. You know what I mean? Like,
Right.
Yeah.
Yeah.
I've written a lot of technical documentation in my lifetime, and it's a little different, but the premise is the same, in that if people can't consume immediately what the content is and then understand if it's what they need, they lose interest and they move on, and then they miss what they need. So
Right.
Thank you.
Right.
I appreciate that you're doing that.
Well, I know the state wants towns to have it, and that's going to be one of the deliverables that DPH is going to be asking for this year. They're going to be coming in. They want to know if you know what SNS is, so we have to go over that. And then the other piece that they're working on is making sure that everybody has some sort of plan. And then the third one is, once again, doing a walkthrough.
Mm-hmm.
So I'm sure that excites you all.
Something to look forward to.
There you
Oh,
go.
yeah.
And all right. So anything else with the EDS plan before we move on?
Nope.
Okay. MPHN?
So we got the annual bill for MPHN, and this was kind of going along the lines of what Kathy was saying. I know Ryan said he's brought it to the board's attention before, but MPHN does offer inspectional services. They could help with things like Title V inspection, well permitting, the food inspections, which all falls under just their inspectional services portion of their services. So right now what we do as the town of Hubbardston is we pay in $1,000 a year for their nursing services. But for an additional $500, we could also
Lost you.
We lost you. Oh, hold on a minute.
Oh dear, the important part.
I know.
MPHN service.
Mallory, we can't hear you. You halfway through that, you froze. You might want to kill your video and just speak to us.
Yes. All right. So I was saying that we pay in yearly for the $1,000 nursing service. That pays for our public health nurse who's been doing all of our COVID monitoring and handling all the tracing and all that good stuff. But they also offer an inspectional service portion as well for $500 a year plus $75 an hour, which is about what you would pay for a private person to come do inspections as well. But that would include housing, food, swimming, beach testing, but our beaches provide the labs of themselves. Any Title V recreational camp, so that would include like Ron Burton's camp, and they would handle private wells as well. So I just wanted to bring that to the attention of the board. It's an option that we have if we're feeling overwhelmed with the inspections. They're all certified. They can do everything from plan review to all the inspections and sign off on the COCs. And I spoke with Ryan about it. He said that it's been presented before. Not 100% sure the feeling of the board, but just wanted to put it out there. And either way, we do have to vote on the nursing service for next year.
Okay.
What are we getting for the nursing service? Because we went through this a long time ago. When I first got on the board the first time, I came across a bill within 2 weeks after I got on the board. A bill came in for $2,000 for nursing services. And when I started checking back to find out exactly what we were getting for the money, I discovered that they had a nurse come in 9 months out of the 12 to do 10 blood pressures a month over at the senior center. And then they offered a flu vaccine clinic for the seniors, which came to about 30 people a year. And we were paying $2,000 for that. So I brought that to the board, and I said, this is crazy, you know, this kind of cost, you know, for these minimal numbers of services. And that's actually how the MRC sort of got started, because I started a nurse volunteer committee. And so we did the vaccine clinics for several years for free as just volunteers. And we had it up we had hundreds coming in at one point. So that's back to my point. I was kind of concerned when I happened to be at that meeting when you folks were discussed about joining that group, the Montechusett group. And I still kind of question it, because you had how many cases, and I mean, yeah, it's nice to have a nurse to do the COVID tracing and do the MAVEN documentation, but it takes me an hour in the morning to do three towns. So are you paying $1,000 for those kinds of services, or are you getting more? If you're getting more out of it, like you're getting home visits and other, and then that person is setting up your vaccine clinic for the whole community, then it's worth $1,000. I'm just saying, putting it out to you.
So they definitely do the MAVEN, they do the COVID, and they do home visits if there's somebody in town that's found to have a communicable disease that needs home visits, quarantine, or medication. So that's is all part of it.
That's all part of the COVID stuff. Yeah.
It's all part of the nursing plan even before COVID. So if somebody was quarantined with, you know, a disease that needed treatment, they would actually go to their home and administer treatment as part of the plan, and then monitor the case and report. What else is on the list, Mallory, that they cover, or is that it? Are those the three main things?
As far as nursing?
Yep.
Yeah, that's pretty much any communicable diseases they were covering, the monitoring and the tracing and home visits for.
Yeah, and in terms of vaccine clinics, to my knowledge, it's not something that they do or is part of their services. I'm sure if we requested it, it may be something, but it isn't a standard part of their services that I'm aware of.
My understanding is this group wanted to grow to be big enough and broad enough, like Neshoba. Neshoba does clinic, flu vaccine clinics, but I know they're smaller and they're younger, so I don't know where they are with those plans.
Right.
Well, that's not impacting what we are getting from them at this time. And we needed to have someone reliable because we didn't have anybody to do the service. So this filled a gap that we really needed to have as part of our Board of Health. And
yeah, at the time we voted on it, we were a 3-member board with, I think I was 2 weeks in.
Right.
Oh, yeah.
And, you know,
we didn't have the help. Right. And I still think with COVID, it is best to have them because I don't think we have enough help. I'm
just saying that, you know, are you getting the return for your money?
Yeah.
You know, and I mean, COVID is, 10 cases in Hubbardston, I had 68 in Barrie alone, plus a couple of clusters, and they've got the Quabbin school, and I certainly hope that nobody over at Quabbin they end up with a cluster over at the regional school, because that would be a nightmare. But, that's a retired nurse could do the same thing, and yeah, that's what I had said, that when I was at that meeting, a retired nurse could do that.
I think the issue is finding those resources to do it. And also, part of the decision of the board at the time was based on trying to put in place services that the town could rely on. And as members of the board switch out and their expertise switch out, it's not going to impact the services.
And the same thing, my argument would be the same thing if you're going to look at, you know, well, we'd want to know what the inspection service is and who's doing it. And, you know, we don't want to walk into where they're already doing, you know, 25 a day for one town, and then we're going to add on top of that. That may cause some delays for us that we particularly don't want.
As opposed to having one inspector, which is me, and my personal delay, which is I can get one done every like 2 weeks with my schedule.
Yeah. Well, you know, it's, I mean, it's something to look at, but my point is, you know, we just need to be looking at it. Are we getting the money's worth that we should be getting? Because $1,000 is a lot.
No, it's not. That's only $100 per person for the 10 cases. $100 for each of the 10 cases, and they've done additional work besides that in the last year. So,
well, that the first $1,000 fee that we pay is they charge us $50 an hour, and once we eat up that $1,000, we'll be charged the $50 on top of that. I haven't received an invoice, so I don't know what hours we're at yet.
So I'm just saying that, you know, we just want to make sure that because I have that. I just remember that bill back then, $2,000 for 10 blood pressures and 30 vaccines. And I mean, it was like a half hour's work a month that we were paying, you know, somebody to do for $2,000 a year.
Yeah, but yeah, from my perspective, I think the issue is that if we always had a board that was made up of the perfect mix, and we had nurses and folks that had, you know, perk experience and people that had food management experience and people who had, you know, maybe health agent background and public health, that wouldn't be an issue. But we're a volunteer board of citizens. We don't always have those resources. And, you know, for me, I think it's more important that we have continuity of service and that things are consistent. Because, you know, I can tell you, as somebody who moved into this town 6 years ago, when I came into town, we went through everyone else goes through a process. You buy a house, it passed Title V, everything's good. You go through your paperwork. I had the septic tank pumped and found a problem. My house should have never passed Title V. So, you know, as a person who's been burned by the inconsistency of services in this town, I think it's important that for the safety of the health of the town, we have consistent services. And if that means we have to outsource them at a higher cost, it's a sinful cost, but it is the cost of doing business as a board in a rural town with limited resources. So in terms of inspection services, I'd like to see I'd like to see like a current invoice from them to understand kind of where we are financially with them. Mm-hmm. And then we could get a sense of, based on the proposed inspection services, how many inspections. I mean, obviously with Title V's, you never know because you don't know how many houses are going to sell in a year. We could look at, you know, history and pick an average. We know how many residential kitchen inspections happen in a year currently, and what that would look like, and maybe start working up, you know, what we think the actual cost would be if we took them on for inspection services, and see, you know, bring it before the next meeting and actually walk through it as a plan. That sound like a good approach to everybody?
Absolutely. And another option that we always have too is, doesn't have to be through MPHN. There are plenty of inspectors that will work per diem as needed, like Jennifer, Susan, Roy did, for the board. So that's something that if we think that MPHN won't be financially responsible for the board to take on, or something that's, I don't know, for whatever reason, we can take a look at posting for a position and having someone private who has all their certifications. A lot of times, retired Board of Health directors, current other towns have Board of Health directors that will come in and work with smaller towns. So it might be something to look at if we don't want to go the MPHN route too.
Right, especially like for witnessing all these tests that I've been doing, to have someone that might do it at a little bit lower rate than the 500 plus $75 an hour. That's why I was throwing out there that maybe we could advertise for septic inspector, not necessarily to do Title V's, but certainly to take over some of the witnessing that I'm doing for these tests. So I was wondering if we could maybe, well, think on it and see if that's part of how we want to approach it. I do think that an individual septic system inspector versus going through MPHN at their rates, an individual would be cheaper.
Potentially. I think we'd have to maybe assess that and find out.
Advertise, so.
And that, along with that, and assessing how much might be a good time to look at our fees and what we charge, because that would be what would essentially be covering the cost of an outside inspector.
Yep.
Right.
That would make sure that we're not overspending ourselves.
Correct.
So I can start taking a look at the average for the last few years, Title V's. And like you said, we have an idea of food, and go from there.
I think it's at least worth looking at, and then we would have a baseline of understanding what the outsource cost is to a group like MPHN, and then we could look at, you know, average costs for an inspector, things like that. I mean, functionally, if the town actually had a full-time health agent, it would be, you know, it would be a salaried role. It would be a lot more expensive than I think what we'd pay in the shared services environment. And, you know, from my perspective, I just think the shared services gives us a buffer and some continuity, because it's really difficult as a board to even keep everybody on the same like level and everybody licensed. You know, the end of this year, when my inspection license runs out, if COVID is still going strong and I can't get relicensed, it's going to be pretty difficult for us to do inspections with nobody licensed to do them. So we're going to be in a little bit of a spot. Anyway, anything else on that before we move forward?
Negative.
All right. New business, I think we're up to. Or unexpected subjects.
I don't know what happened with my spacing, but after MPHN was.
Oh, it's all the way down the bottom. It's another page down. Yep. Old business, food inspections. And Mallory, you just went out again.
Well, you did one last week, right, Kate?
I did Tina Dixon.
Okay.
And the Rod and Gun Club have been done since the last meeting.
The Rod and Gun Club, you know, put a plan forward to reopening, but nothing's happening. Have you heard anything?
No, not yet. So I went in, I walked through kind of their whole process and how they're gonna. I inspected the kitchens and talked to them about where they're cooking, if you know how they're moved, because they have like a full-size kitchen upstairs and like a partial one downstairs, basically. So they're gonna be cooking upstairs, bringing the food downstairs. But you know, talk to them about food source, temperature, time control, all of the entire inspection, and then let them know that when they're up and operational, I would drop back in one night and just kind of, you know, observe, make sure that everything's flowing and working according to what they'd said. And John was fine with that. It was everything was in unbelievably clean condition. I think they've been closed for so long, they just keep cleaning. There's like nothing to do.
Wow.
But, yeah. And you know, they have a good plan. They're gonna be spaced out. They have plenty of space in their dining area, you know, downstairs, upstairs, if they're gonna have people eating. And then, you know, it looked really good. And then Tina Dixon was a residential kitchen. Oh, and Mallory, if you can hear me, she said she owes you a permit fee, and she asked me to take it, and I asked her to bring it to you instead, because I don't like handling checks.
No, that's fine.
I have to submit that paperwork to you for you to send a copy to her. So
Okay.
I'll drop that off sometime this week.
Sounds good. I'll be there.
And I'll try to find time next week to do 1 or 2 more between my work and my personal schedule. It has been a little hectic. I've been trying to I literally am like in front of my computer every day from 6 in the morning till 8 or 10 at night.
Yeah.
So it's difficult to find an hour to get away. It's not been good. I walked the mailbox once last week. It was exciting.
Baby steps, Kate.
I know. All right. Let's see, back to the agenda.
Recycle center.
Recycle center and Bella's report.
Bella's report looked good.
Yeah, she'd had a slower week. It's the last week that she operates. So, and really is what it is.
No problems.
Okay. And 36 Gardner Road, the site plan. So this is the site plan for the storage. Yeah.
Mm-hmm. I haven't gotten anything new from the planning board. They dropped off a full-size set of plans that Vin reviewed.
Mm-hmm.
I know they're having their hearing this week.
Oh yes, when's the date of that hearing again?
Thursday?
This Thursday? No, next, the 22nd, right?
Yeah, I think, let me take a look. Not 100%. Meetings. Planning board has a public hearing for site plan review this Thursday at 6:45.
Really? I was thinking it was the 22nd. Why is that? I don't know. Oh, it is 6:45 Thursday. So I don't think that we have to ask them to put septic and everything in if they don't want it at this time. I talked with someone today and they suggested, well, it was Rich Stevens, who is a health agent in 2 other towns, as well as he does perk tests. He suggested that the board could stipulate, our board of health could stipulate that if the site expands with an office, that a septic, water and septic must be put in, and we can have that put in the deed when the deed goes through. And this way it's on record, the vote and opinion of the Board of Health in regards to future growth of the site. Because
so I think that if an office goes in, the plumbing code mandates that a bathroom is supplied for employees, the building code, and then at that point
they would have to
put in the water. Yeah, I don't know if we need to include that because building code would.
And that's something that's never going to change, is it? So we don't have to worry about that.
No, yeah. I mean, building code, if there's employees, I'm pretty sure states that.
Yeah, okay. As long as that's definitely part of the building code, or if an office goes in.
Yeah, I believe it's.
Well, if you could make sure that we have that as part of, then they can go ahead and build it without an office if they want, without any water or septic. I know Vin is very concerned that the town didn't stipulate these things for a couple other sites, and then things were done on the sly. I can't remember the location. He told me, but that's his concern. So I'm just repeating what he's concerned about. If their building code is 100% clear that this is mandated, then it's not an issue anymore.
I would state that it wasn't an issue to begin with because we can't tell a business how to operate based on the fact that we think they should have plumbing. That's just my opinion, and I'd like it on record.
Okay. So at this point, I guess we don't need to do anything other than if we're concerned we should go to the public hearing this Thursday at 6:45.
Is that going to be a Zoom meeting?
Yeah.
How do you get on the list for that?
I can send you the link, but if you just go onto the town's website under meetings, planning board meeting will have a hyperlink right in their agenda for you to click.
Oh, okay.
Okay, thanks.
Okay. Anything else on the 36 Gardner Road site? All right, budget spreadsheet.
So we didn't have any bills to pay. So it's just what I turned over. It's just all those perk fees that Kathy has been doing. And then I also put in what Bella turned over, which I believe was 145. I don't have it in front of me. But that's pretty much it. Nothing too crazy.
All right, and the flu clinic.
So we were supposed to have a flu clinic come through last week for employees and for the seniors. Claudia had set it up with, and I had spoken with Walgreens, but they kind of decided to just smush it all into one flu clinic for employees and seniors. So Claudia had the hands on there, spoke with the nurse last week, the day before the flu clinic was supposed to start, and she had not filed the correct paperwork with the state, so it had to be rescheduled to November 4th. She is open to opening up the flu clinic to anyone who's interested. So it doesn't have to be a senior, it can be any resident. Just needs to make an appointment prior, so that I'm waiting for Walgreens to send me their flyer. I should have it by the end of the week, and then we can open it up to anyone who wants to come in, and they will do all the reporting through MIIS. And take care of everything start to finish for us.
That sounds great.
You will have to start looking down the road, though. If we actually get a vaccine, we need to start putting all the pieces in place for the corona vaccine. Yes. And just as an FYI, the state is bringing in extra vaccine because of the mandate for the children. Right. And I know a couple other towns are looking at possibly trying to have a school vaccine clinic. But again, getting onto the system MIIS, and then also making sure that you have a current Board of Health number. I think DPH has assigned every town a number anyway. Mallory, you were going to try and hunt down that number.
I've literally been talking to them more than I talk to my own kids, I feel like. So trying to crack the code and get me onto the system. So we had to do some verification with the town so that they know I'm a legitimate employee. And right now we're just waiting for the confirmation so I can get logged in, but it looks like we're at the tail end of all of that.
Okay, and you found the town number. The town was supposed to have that. It's a number that allows you to order the vaccine.
Yeah, I believe that was on one of the forms that I found.
Okay. Yeah. And when you get into MIIS and they say they want to do your training, I'd love to sit in on it as well.
And even just log in to start the training?
Well, usually these systems have a training.
Oh, yeah.
Yeah. So I'd love to sit in on it. I mean, I saw the system when I was working at UMass. So, but I never had worked it. So it would be interesting to just sit in on it and kind of learn a little more about it.
Yeah. So what I've been doing now is on the MIIS website. You can access a lot of the trainings and the webinars. So I've just been kind of pecking my way through those when I have free time. And then I think once I get access, I'll be able to go into like training mode, and then we'll be able to play with it. So you can come in and we can work on that together.
We can play with it.
Lucky us.
Well, the problem with these databases that they put together, I mean, you know, they're huge databases, and even now I've been doing Maven for a couple of years, and now, you know, I'm still finding spaces, you know, and still finding spots that, oh, I can do this, you know. Oh, look at this. This is another piece of data I didn't even know I could access this way. So instead of going through the front door, I can go through the back door, you know, all that. So it's kind of fun, but I like it anyway. So I'm a little strange.
I'm the person that designs those data systems for a living, so.
So we get to blame you.
You can. Data architecture. It's real fun.
Yeah.
All right. Anything else on the agenda? We covered it all. Anything unexpected subjects? Anything anyone else has to throw out there? Going once? All right. Hearing none. I'll make a motion to adjourn at 7:45. All right.
Right.
Okay. Kathy seconds. All in aye.
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 Aye.